Remember us from training? We're here again. We're just here now today to just remind you exactly what you should be doing with medication. We're just going to go quickly over the levels. We're just going to go over the correct procedure for doing medication. We want you to remember how important medication is. Think about it. Anything else that you do in your role as a carer, you can have another go at it. Medication, once you administer it, your client swallows it, there's no going back. Okay, when you're looking at your risk assessment, if you get to the house, first thing you need to do is check which level it is, whether it's a level 1 or a level 2 medication. Level 1 means that you are just offering general assistance, but for level 1 you're not entitled to actually administer or select any medication at all. It is just general assistance. Level 2 in the care plan, when you look at level 2, that means that the carer is actually responsible for the medication. So they're selecting, they're counting out and administering it to the client for them to take. For level 3 medication, you're unable to do that unless you've had the specialist training first. So if you come across any medication that's for level 3, you need to contact the office and make sure that you've got relevant training in place. Some level 3 medication can be done by a distance learning pack, but you also need a professional person to come to the house and train you in the correct technique of administration.
Okay, so what's a level 1?
Right, level 1, if you're assisting your client with the medication, level 1 means that you can actually handle the container, you can hold it, you can do anything you like, you just cannot select from it. If your client can't get the top off, it does allow you to open the top for them, but then you would have to say, there you are, there's your tablets.
So I'm not allowed to tip out into
No,
their hands?
as soon as you start tipping medication out, you are selecting tablets for them to take. They need to be able to tell you that this is the tablet they've got to take. So you can't go to their cupboard or their kitchen and think, right, this is what they're having. There you are, you've got to take these. They need to say to you, this is my tablet, this is what I want to take today. I've got to have one of these, but I can't get the top off. And then you could open it and pass it to them, or you could just loosen the top and leave it like that.
So what's the responsibility to the carer on that?
There is no responsibility at all to the carer. There is no selecting, there's no counting out, there's nothing. Just basically taking the top off. It could be a jar of coffee and they just can't get the top off. They're responsible. That's as far as it goes. Level 2 means that you're responsible, so it's easy for the clients may get a little confused over what tablets they need to take, or it could be that they just can't, they just want you to be more responsible, they want you to do it for them. So what they would do then is say, or you would do as a carer, is look at what times the medication needs to be taken, check your care plan first. You cannot give any tablets unless they're written in that care plan. So you need to make sure on page 9 on the risk assessment that medication is on there. First thing obviously that you do is wash your hands, because this is something, if you're touching it, we try to not touch tablets, but if it is touched, that person's got to swallow it, put it in their mouth. So what you do first is wash your hands. Some medication requires you to wear gloves, depending on the type of medication that it is. Check your care plan. And the easiest way of doing any of this is to work through each tablet one at a time, because I think a lot of mistakes are made when carers have got 5 different types of medicine and they get it all out ready to give. If you work through one bottle at a time, take out the required quantity, administer it to your client and then sign for it to make sure it's all going well. But level 2 does mean that you are selecting, you're counting out the tablets to take. You must make sure that the risk assessment on medication is exactly the same as what's on the prescription label. Okay, so if it says in the care plan 2 500mg tablets, on this label it should say 2 500mg tablets to be taken at or as and when, as per the instructions. Then you're allowed to open the container, and you are actually allowed this time to count the tablets out. Some clients have little pots that they go straight into, others may want a little saucer to pop it on, others will have it straight into their hand, but you're actually counting and taking responsibility for what they are going to take.
So what if I get there and there's more medication on the side than what there is in the care plan?
The only medication that you can give is what's in here. The only medication is written onto the care plan, and that's it. Anything extra to that, no, you don't give. You would have to contact your line manager, and either they will be able to give you consent to update the risk assessment within the care plan, and they'll update our copy, or they will send out a risk assessor to do it.
So I need to follow the care plan first to give the medication from that, but never follow the mark sheet. That should come second.
You can't give what's on the mark sheet. The mark sheet is purely a record of what you have done. So anything that's on there, you're not actually administering medication from. You can only administer from the risk assessment within the care plan. The mark sheet backs you up on what you have done.
So I should always check the care plan first,
Yes,
and then the mark
anything-
sheet second.
Yeah. So anything that's on there, yes, you can do. If it's not in this book, no, you can't. There's quite a few what-if questions. If you've got any more or if you'd like to view these, please check the members area.